Group 2's presentation, Hepatitis A Outbreak in the Midwest. Hepatitis A is a liver infection caused by the hepatitis A virus. It is highly contagious and is usually transmitted by fecal/oral route, person to person, or contaminated food or water. The infectious period is usually 2 weeks prior and 1 week after the jaundice symptoms begin, and the best prevention is vaccination. December 1st, 1998, a Midwest state reported 48 cases of hepatitis A to the CDC. The cases were basically reported from two counties, County R and County L, which are 100 miles apart, and two restaurants were identified as sources, Restaurant A and Restaurant Y. So the management roles and responsibilities is managers are basically responsible for determining how the disease was transmitted to the patients, what are the sources of the disease, and determine the risk, who, when, where. Also, they needed to determine what health care and quality control actions were needed to prevent something like this happening again. First, we had to take a look at all the subjects and the data. Basically, your subjects were broken down into case patients. They were the dining partners of the case patients. They took other healthy restaurant patrons, and they also looked at the chefs because they were involved with the preparation of food. They took these classifications and they ended up breaking them down by gender, race, and they also looked at the dates they actually dined in the restaurants. We're going to compare the two counties to each other. We're going to take a look at County R that targeted a study at Restaurant A. Restaurant A is where 64% of the reported cases mentioned that they had dined. There were no high-risk behaviors detected, and the data ended up red flagging green onions. In County L, they targeted restaurants and grocery stores, and what they found is 71% of the reported cases had eaten at Restaurant Y. There were 3 risky behaviors noted, such as there were 2 international travelers and 1 a drug use, but there were no common food issues found. One of the major things this does for leadership is it helps make decisions. And instead of basing decisions on opinions, they're basing it on knowledge that comes from basic sciences. They use clinical facts versus opinions. They are more frequently used to guide recommendations and actions, and it also adds value to improving health for patients and public health. So when it came to the clinical decision making, they had to look at how hepatitis is spread from person to person or from contaminated water or food. So they used this survey along with their clinical knowledge to determine that Restaurant A, there was a factor that linked everything towards the green onions, and at Restaurant Y, nothing kind of commonly linked it, so they're linking it to hand hygiene at the restaurant. So this data is what we call evidence, and this evidence is used to help us do evaluations and make decisions. There are 4 different evidence-based areas. The first one is the distribution of health. The second is the determinants of health. The third is the impact on the health of the individuals and the public. And the fourth is the ways to change health determinants. So when we take the data, the evidence, and the leadership, the managers, then what they're going to do is they're going to evaluate that data to come up with planning decisions to benefit the public. The analytical epidemiology they used to find the source of the outbreak, and then they wanted to go into changing health determinants, making those recommendations. As for Restaurant A, they're going to reinforce field sanitation, and for Restaurant Y, they're going to reinforce strict hand hygiene for your employees. So what we're saying is that epidemiologic and clinical-based evidence helps us make recommendations, helps enable and motivate to follow guidelines, and also helps us with a common goal to reduce the present and future burden of hepatitis A breakouts. Thank you, and I hope you enjoyed our presentation.